So I'm not sure where Kim is, but I guess we'll make a start in the interest of time. And then if she does join in, that would be great. We can just catch up. So I'll just do some introductions, start off with some introductions on the session for those that are watching. And then hopefully Kim will be able to join in for the questions. So the purpose of this session basically is to discuss the UN Sustainable Development Goal number 3, which focuses on health and well-being. And that's about promoting healthy lifestyles, preventative measures, and modern efficient healthcare for everyone. But basically, I mean, if you look at the goals around this particular, the UN bit, it really, the underlying theme of it is how we can make low and income middle countries catch up to the level of the high income countries, and how we can actually have more equitable, basically, healthcare provision across the board. So Super Connect for Good competition is really about bringing about the tech for good startups and scale ups, that address one or more of these UN global goals. So a couple of the pitches actually that we've seen, especially yours, Marche, was actually quite good, because that actually demonstrates, how you can make things more fair, more equitable, is take the care to the patient rather than waiting for everybody to filter in through sort of the expensive and larger healthcare centers. And working in the NHS, or being familiar with the NHS, we all sort of understand sort of what that looks like in terms of waiting times and eventually getting the treatment and stuff. So for the purposes of those watching, the global goals on this is really about ensuring healthy lives, promoting well-being at all ages, and with the recent global health crisis in the form of COVID.
Yeah.
We may have lost V.
Yeah.
I think we may have lost V with a poor internet connection. Yes, we have.
Hey, good.
V, you're back.
We can hear you. We can hear you now.
It was weird. I was on the screen and everything's working fine. Just in my audio's there. Yeah, so sorry. So I'll just quickly introduce you guys to the people who are watching, and then I think we can get into the questions. And if anyone's watching, please pop in your questions in the Q&A panel on the right-hand side of your screen. So today we've got Dr. Leslie Booth, MBE, Director of Research and Public and Patient Involvement and Engagement at Bauer Research UK. We've also got Maciej Zurek, founder and CEO of Remed VR and regional winner for Central and Eastern Europe. So some of you might have seen his pitch. And we are hoping to be joined by Dr. Kim Johnston from Regional Partnerships Director from City Fiber. However, if she doesn't join in, we'll just sort of carry on. She might be having technical problems. So basically, I'll start with you, Leslie, because that's the order you got on my screen. If you can just introduce yourself, your organization, and then Maciej, I'll come to you, and then we'll go to the questions. So Leslie.
Yes, hello everyone. My name's Leslie Booth. I'm Director of Research in Patient and Public Involvement and Engagement at the charity Bauer Research UK. We are a medical research funding charity, and we are particularly interested in democratisation of healthcare through the grants that we fund, and also the role of medtech. And I'm pleased to be with you here today.
Thank you, Leslie. Maciej?
Yes, fantastic. Yes, it's great to be here, and I think that we will have a lot to talk about with Leslie off the record, because Remed is a telemedical platform that utilizes proprietary technologies that yeah, they are in just on a technology level, they are an innovation on a global scale. So we have patents on them, but what we bring to the table in terms of applications in healthcare is, I think, to the point of democratizing access, especially through lower cost of delivering care and creating new points of care where we can install our solution, which is both software and hardware, for people to get screened for all kinds of vision impairments, but also for early detection of neurodegenerative disorders. So I think that that could be something interesting, not only for developing countries and countries that have difficulties with accessing their healthcare providers, but also for the whole European Union, as we're able to get our solution pretty much anywhere, like for primary care physicians, in optic stores, in pharmacies, and our solution does not require any skilled personnel to run those tests. It's all fully automated, and all the data gets directly to the database and gets distributed to the right points of care that the patient should follow up with.
I think V might have frozen now.
I think V's gone again.
Yes, yep. It happened. It happened already. So yes, Kim.
Do introduce yourself,
yes,
Kim.
Please.
Hi. So yeah, I'm Kim Johnston. I am Regional Partnership Director for CityFibre. CityFibre is a broadband company in the UK. We're currently investing something around about £4 billion to put full fibre technology across the whole of England and Scotland at the moment.
Thank you for that. Yeah, at some point, I'll start you off on some questions, and then what I'll try and do is actually switch my laptop to 4G. So yeah, I might disappear off the screen. Yeah, so thank you all for introducing yourselves. Kim, as I was mentioning before, if you take a look at the sustainable goal number 3 that this roundtable is talking about, a whole lot of it really is about leveling up in terms of low and middle income countries and making sure they also have access to the same levels of care and healthcare services. And it's also about reducing the mortality from mainly communicable diseases, so HIV, AIDS, tuberculosis, maternal deaths. But there also is something around reducing mortality from the non-communicable diseases, which we sort of tend to fall into. And that is where medtech and health tech tends to really come into its own. So I guess, I think for the purposes of this roundtable discussion, I would like to focus more on the non-communicable stuff, because that's really what we've seen a lot of the technology around. But I also think that's where most of the relevance around the medtech and health tech actually comes in for this particular sustainable goal. So I'll start with Leslie. Knowing what you know about the UN Sustainable Goal, how can we be more prepared for the future, and what measures do we need to take? We've all seen the disruption that COVID-19 has had. What other things that we need to start thinking about in terms of preparing for future disruptions? Because this has happened once, and it's likely to happen again sometime in the near future.
My goodness, V, that is an excellent question. I think the pandemic has shown the disparity and particularly disparity in resilience of healthcare systems globally. However, what it has enabled researchers to do, and such projects that I'm involved in COVID Surge, which was a global project looking at what happened to surgery within the pandemic in country. And I think that what we've got to do is look at the data, lift it out from a very regional, national perspective, and lift that up in joining up voices to the table with regards to policy within healthcare globally, so that we've got some very clear messaging going forward in the future, and we learn from lessons from the past. I don't even begin to pretend that this is an easy thing, but what the pandemic has shown us is that normally we are far more interested in country healthcare issues, but for all of us, patients and the public and healthcare professionals, we were actually looking at it on a global level, monitoring what was happening globally, and we should take the good practice from that and embed it into making sure that we within our individual countries continue to look globally at issues.
Yeah, that's an interesting point you raise about
V, we're struggling to hear you again, I'm afraid. Shall I jump in here? And actually, because one of the reasons I've been invited onto the panel is to talk a little bit about connectivity, and in two forms. So connectivity between partnership organizations and sharing what you were just saying there, Leslie, about best practice and sharing data across groups and the need for it, but also the practical ability to have connectivity as in internet connectivity. We've all seen the importance of it over the last year, 2 years now. And some countries have really coped with it quite well, and some haven't. And I think the sharing of data, being able to get information out, it's been quite clear that those countries that have the infrastructure to cope have done better, among other reasons. But I wouldn't rule out, I wouldn't make assumptions as to which countries are actually got the better connectivity. The UK, of which 3 of us are based in, don't have full fibre to the extent of some European countries. So from a full fibre connectivity perspective, you've got places like Spain and Sweden that are leading the way with nearly 65% of the country on full fibre. In the UK, we're woefully at about 3.5% of the country. It's one of the things that City Fibre are doing. We're building out a full fibre network. And full fibre to me isn't about the fancy speeds and the uploads, though that is going to become more important, particularly when we're talking about visual software. So when you're talking about using virtual reality, you need that upload as well as the download, and you've got to have the connectivity. So you've got, when you're going to be in a, whether it's an optician's or whether you're going to be in the back of a library even, doing eye tests, you're going to have that facility having the upload speed and download speed to allow it to be effective and also reliable, because ultimately you don't want to turn up in it and it not work. So that, sorry, V, I just jumped in and made and told what I know about, really.
No, it's fine. It makes the point perfectly. Like you said, we're here in the United Kingdom. Even I keep breaking in and out. So, I think this is going to be a theme for the next couple of minutes. But I think you make the point perfectly, because if you're looking at medtech and health tech, there's a lot of talk about, like you said, AR, VR, artificial intelligence, or talk about servers and all these things. Mm-hmm. If we're going to be making the world a bit more equal, then there's bigger things that we probably need to address, like actually the infrastructure, before you can actually get in some of these really good technologies. So I'll just move on to you, Marche, because obviously you've got something that will obviously rely on very good internet connections. Can you still hear me?
Yes.
Go ahead.
It's actually very, very relevant. Everything that's been said by both Leslie and Kim in our case, in WeMed case, because first of all, for some of our clients, which are vision therapy clinics, we were the only solution that they could use to work with their patients remotely while being in lockdown. So we were enabling both patients to run, to still be in the therapeutic process, but the providers to actually sustain their businesses. So for that reason, connectivity was crucial, and we did have to change some of our initial plans as we envisioned them in the first place. Especially in terms of like telepresence and running those remote sessions with live stream from virtual reality goggles to the control panel of a therapist, because of the connectivity issues. And we tried to use our patients' Wi-Fi at home. For some of them, Wi-Fi services were not available. They did not have like proper Wi-Fi at home. So we equipped our VR sets with GSM modules to plug them with the SIM cards and get them access to the internet. But then again, not in every place in the country reception is equally good. So we had those issues again, that in some places it was running great, especially where 5G was available, but in other places that stream was just not possible, and that's why we had to like cut our remote access to whatever happens in patients' headset to like three levels of information: just the basic feed of data, some images, and then full live stream of everything that happens. And yeah, having Kim and the fiber that her company provides, we would be able to have like full functionality from day one. That is much more effective in terms of therapeutic results.
Yeah, thank you. So I guess we've got a question here, so I'm happy for anyone to sort of take this up. But so in terms of, so you mentioned sort of how you're using sort of Wi-Fi, and obviously it differs between who's got 5G and who doesn't. And there's a question here around whether you think regulation or legislation has a role to play in terms of actually leveling up in terms of the connectivity to make the health tech and med tech more accessible to everybody else. Does anyone want to answer that question? Or
I think it's a straightforward yes. The more that can, it's a difficult one, isn't it? So if you bring in national, force it through, you can also take away the competition that can develop, and through the competition you get innovation, you get lower costs, and you get probably a quicker rollout. So that, I would suggest, is a tricky one. I think it's a combination of lots of different types of policies. It isn't just about connectivity in a fiber sense. It's about that, to go back to Leslie's point at the start, it's being able to share best practice across countries and internally within countries. I think that's the difficulty. Is a lot of legislation is national, is sort of down to a country level as opposed to international, and that's the struggle a little bit. Leslie might have more information on that than myself.
Thank you, Kim. Yeah, we do see it from a healthcare situation. I'm not a particular expert in connectivity, but your points are very well made, and it translates itself into policy and practice when trying to get in new devices, for example, and regulation, etc., can vary depending on healthcare systems locally.
Yeah, thank you. So, if we look at the world in the next 10 years, what do you think this landscape is going to look like in terms of the reach of health tech and med tech in the low and middle income countries. Do we think a decade is long enough? Do you think we would have achieved that by that stage, or we're still going to be grappling with connectivity issues?
Well, maybe I can jump in first here, because we're exploring India in terms of launching our services there for quite some time now, and COVID made it very difficult, but the interest in our solution in India is far, far greater than in any of the European countries or even in the United States where we are present, because they see our solution as a real real help in equalizing access to services, and for some optometrists, vision therapists, ophthalmologists that we work with or spoke with, their initial reaction was, okay, but if you put all of those features into your hardware, and you will have both ability to project images and then measure the reaction of the eyes, and you put machine learning, artificial intelligence on top of that, you will make that process automated at some point. And well, yes, it will be automated at some point, and I mean that's where every I think industry is heading towards into more and more automation. So yes, there will be a lot of people who are currently working in this industry having to change a little bit what they do or maybe how they do it. But for a country like India, they had no concerns about it, because they said, we have so many people and so little doctors and optometrists and orthoptists, vision therapists, that we cannot handle like those masses. And if you are bringing a solution that is enabling us to serve 6 to 8 times more patients remotely than in clinic on the same exact resources, we want it now and here today. And so I believe that any technology that is making access easier, that is lowering the prices, that is also utilizing less and less highly skilled personnel, is giving better treatment to people. So yes, of course, in Europe we may say, okay, we have enough doctors, okay, we spoiled, it's okay, we don't need that, everybody needs a job, fine. But there are countries, to your point, V, that just don't have those opportunities, and they need what we bring to them, and they're so like happy. I don't even think about a better word to say. They are just, they're just like excited that, okay, finally we will be able to bring the treatment to the people that we were not just being able to handle.
I think that's a very key point. It's bringing the treatment to the people. It's where the people are, rather than getting them to go to where the treatment is. And that, I think, is going to be quite key over the next decade. A lot more home-based care, a lot of self-based care, and a lot of more accessible, as in physically in a localized area. I think it's quite exciting.
And I'd just like to add to both the great points that Kim and Mac have made, in that, health tech and med tech, you guys challenge. You really do challenge current health systems, and that's what it's all about. That's what we want from you, is you're really looking at that. You're both a rebuke and a reminder that, different is as equal as and can be better than we've currently got for patient benefit. And that's what makes this whole area so exciting.
Absolutely.
Yeah, thank you. And I think on the topic of that, in terms of how exciting it is for medtech and health tech, I think, for me, the next 10 years is for medtech and health tech to actually catch up. Because if you look at some of the low and middle income countries, financial technology, for example, has been way ahead of the game. So in a lot of these countries, people don't actually own bank accounts. Everything's always been done by phone. And in some countries, actually, they've been doing mobile banking before the UK and the rest of Europe actually has been, because that's the technology that came first. So the appetite for the technology is there. And to Macha's point, I think it's about making it available and accessible for people. And in some ways, you'd think the infrastructure would sort of follow as they start to see the benefits from it. And maybe that could allow some of that competition and innovation to come in, as you've mentioned, Kim. So, personally, I think we're living in an age where the information is just moving so more rapidly than it ever has. So it will definitely sort of spread to there.
I think I'd just like to add a negative point in that, though. I think for some of the medtech companies that are starting up, you've got to be, it's not good enough to just invent something and have it out there. It's about business development, it's about marketing, it's about sales. And in a way, that's actually more important. If you've not got those connections to get in for clinical trials or to be accepted by the clinical community at a wider level, that you're going to hit those barriers straight away. So I think that's why it's so important to have things like the event and the competition we're having today, to give people the opportunities to connect and share those contacts and the connections in a business sense. Because I think we're in danger of losing some really great innovation and medtech just purely because they don't have the business acumen to get it to the next level.
Yeah, I mean, if I could just add one thing to that, maybe two things. I'm actually from a business background. I've spent 12 years in marketing and sales in big corporates before I left and actually joined the company that became Remed. So that's one thing, and I saw at that time that there was a huge demand among startups for the type of skills that I can bring to the table, because there were a lot of, to your point, Kim, startups that had great technology, and that technology was working, and sometimes there was even a clear use case, but they couldn't really package it, they couldn't really calculate it and sell it to make it profitable. So I believe that we could think about some, encouragement for that shift of talent from corporate world to startups, which is happening. But I think that if we talk about it more among corporate employees, we might trigger that thinking. Okay, maybe I've already done all the things that were to be done here, and I can just move to the next challenge in my life and contribute with whatever I have learned to a new business and to bringing that business to life. And that's one thing. And the other thing is that again, because we are in medtech, because we are in health tech, it is so much more difficult than in any other industry to bring those products to life and issue a first invoice. The runway is so much longer because of all the regulations that we have to meet, like clinical trials that you've mentioned that are awfully expensive, about medical certifications, about getting through all the reimbursement procedures. This is not easy. And in the countries like India, they make it all possible much, much quicker because they have to look for solutions because they are so much behind, but they are getting ahead of us, like in terms of those financial services, because they are so flexible in yeah, so I think that it's both talent on the business side. It's financing that is needed for those long years of development and testing and certifying and getting reimbursed before you can start selling. And then the last point is that yeah, we really need to have an understanding that if the system is not simplified, it will just kill a lot of innovation, because they will simply bleed out before they can start selling. I don't know if that was helpful.
No, it was it was actually
a lot of
helpful,
challenges. I'm sorry, but
no, there's 2 points that will lead up to it. I work for, we support sort of companies in just the development and evaluation. So we help them get the clinical trials, and we help them navigate some of the healthcare regulations and types of things. But one of the things, the route to commercialization or the route to adoption, is people don't actually understand. You might have a brilliant product, but if you can't market yourself as a business and have a sound business model, that's going to impact on how quickly things get in there. So there's definitely a need for that. And one of our sort of sister organizations we work with, they also do the same thing that we do here in the United Kingdom, but in India. And they're actually looking at bringing across a technique that's been developed in India because of the low resource setting, and bringing it over into the NHS, because actually it does, in terms of patient outcomes, they're no different, but it's actually far much cheaper. And if you're looking at climate and sustainability, it's actually a very green procedure. But it's based the use of carbon dioxide. In India, they've developed a way where you don't need to use that carbon dioxide gas that we use here in this country. So, there's loads of new things that can actually cross over, that we can actually learn from. Is, one of the things we've seen is a lot of technologies, developed for the high income countries are very resource heavy, very infrastructure heavy, because that's what we have. So that's what we design our products along. Whereas in other countries, they've got to go on a different tangent and actually figure out what works in our setting. And going back to the challenges you mentioned, Kim, for startups, it's also about, if you want to develop med tech and health tech, that's actually going to meet the goals for a lot of these countries. It's actually thinking about those two different environments as well. Actually, it works here in France. If it works in France, can it actually go work in South Africa? Can it work in Brazil? That's another challenge, I think, that startups now have to face. Whereas I think before, it was just do something for your own particular setting. It works there, that's fine. There's no incentive to really develop it for everybody. Okay, so I'll go. There's one question, and I don't know who wants to take this, because this sounds like for someone very technical minded. What do the panel think about using gamification and nudge theory to encourage people to be more active?
I have to say, I think gamification is a brilliant idea. As a mum of a 15-year-old son, if it can physically get him off the sofa and actually physically do some activity in a way that is sustainable, obviously the VR set that you use is very much gamified as well. And I think it's about keeping people engaged. It's keeping them wanting to work on it. Just as a personal side, I also have a daughter who had an eyesight issue. And we tried going down the Oculus Rift route and early doors, trying to do what you're actually doing now commercially. And it didn't work because there weren't the games, there wasn't the interest there. And I think it's about, I've just seen somebody saying it's a tough market with the kids. It's a tough market, but also they're our future. So if they start to use gamification and tech and seeing the capabilities of it in their own life and in fun, they're more likely to consider that idea to make health tech more interesting in years to come, and also more accessible for most people. So philosophy.
I think that gamification is I think is a key in any sort of progress. I would say learning, therapy. If you are able to turn something into fun, then it's always more engaging. You know, if people enjoy what they do, they will be coming to do it more and more often. So the whole system that we design is around exercises that are gamificated, and that they were designed to be suitable for kids of 40 years of age and older, of course, but it's suitable for the youngest to interact with, and all of those exercises were designed to be run in a standing position. Of course, you can do it sitting, but there is a whole body movement, like not only hand-eye coordination, but full body eye coordination tasks that are not only for binocular vision disorders such as amblyopia and strabismus, but we're also now entering neurovision rehabilitation for patients that are post-stroke, brain damage, concussion. So we're able to help them to get better by engaging with virtual reality content that is interactive, that is gamificated, that requires them to move around in virtual reality. So the technology is fantastic, and you know, when we compare what we have in our hands today with you know the first Oculus, that's like decades. I don't know, it's ages. And
especially now you've solved the motion sickness issue, because I
yeah, I mean that's one of the things that is available in pretty much every headset that is now on the market, and we were the first ones about 2 years ago to introduce mobile VR headset with full body tracking. So that motion sickness effect was raised because every move that you made in virtual reality, I mean, outside, was transferred onto your avatar, and everything that was done inside was also corresponding with everything that happened outside, so that, you know, sickness is usually associated with the lack of correspondence between what's inside a headset and outside, and that's now solved, and that's now available in every commercial headset, and we had it as a special customized feature in the headset that we were using 2 years ago. So and there will be more and more innovations coming, like the pancake optics, which is a new type of display that will make a virtual reality headset very thin, pretty much like a AR headset, so the see-through headset, and this will enable a lot more younger and also older people, and also people with some, you know, disabilities, to use those headsets because of the lightweight, for any, you know, kind of learning, training, rehabilitation purposes. So yeah, I think that I believe that VR is much more suitable for actually B2B cases, for rather than for games as well, of course. But apart from games, I don't see much, you know, consumer applications for virtual reality. It's a different story with AR, because that I think will be a new interface that will substitute our phones. We will just not need to have any phone in our pocket. Everything will be in our see-through glasses with some additional layers of information coming out on the screen on demand when we want them, and then, you know, making this piece of heavy plastic or metal obsolete. So yeah, cheers to that.
Yeah, looking forward to that, scaringly enough. But I think we probably need to wrap up now. So I'm going to ask each one of you a question to finish off. And that is, what is your organization doing to support the health and well-being of those, first of all, within your company and the beneficiaries you support? So I'll start with you, Leslie.
As a charity, we take the health and well-being of our staff and the researchers that we fund and the patients who are involved in our research projects very seriously indeed. So we are looking after people's mental health and well-being. We're being very flexible. We're being very flexible in no-cost extensions for grant holders. We're trying to ensure that people aren't put under pressure, and that we, the charity, are here to help and support all the communities that we engage with.
Thank you. Kim?
Well, CityFibre is a brilliant company to work for. Through lockdown, they were hugely supportive and instigated a number of things, some of which are still running today. Like, for example, we're not supposed to have any virtual meetings 1 o'clock to 2 o'clock every day. And we use that time to get up, go for a walk, look at the sky, or whatever, just not be on a virtual call. Simple things like that make a real difference, and they've been great, and they've continued to do it. From a rollout to our customers, we've made sure that where we are connecting cities and homes with full fibre, we don't cherry pick those areas that are more likely to buy our services. We actually cover a whole city and a whole the whole demographic across an area. I think it's very important to give everybody an opportunity to access the internet and full fibre, ideally, if they can. So we're not inclusive.
Yeah.
No, exclusive. Exclusive.
Yeah.
We are inclusive.
We are inclusive. Yes, yes.
We are inclusive. Yeah.
Yeah. Marche?
Yes. Well, I think that the way we build our organization was to enable everyone to bring the best that they have. Our primary criteria that we recruit on is passion. So we just look for people who are passionate about something that they do, and we enable them to do this and only this, taking all of the things that they find difficult or boring or just not worth spending their time on, to other people who are excited about those things. And we're very flexible with when and how and where people want to work. Even before COVID, we didn't really have a strict policy of coming to the office. We're also very spread out because our R&D is in Poland, but we have sales organization in the US, where I'm based as well. We also have recently opened an office in UAE for the Gulf area, and I think that we're getting ready to open our office in India as well. So starting with our organization, I think that actually leads us that very wide exposure to different cultures and different also different problems that healthcare is having in those countries. We're trying to equalize the access to services and make those services really accessible also from the price point of view. To Kim's point, I was very fortunate to have a co-founder who is our CTO, but apart from being software developer and engineer, he's also very, very business savvy and like business oriented. And we were always looking for solutions that would be very, very cost effective in terms of our cost to deliver them to the market, and then also the expected pricing to make them available to as wide audience as possible. So yes, we're all about democratizing of access to healthcare, equal opportunities, serving the underserved in both rural areas, but also in developing countries. And so this is all what we have in the back of our head, and this is what I think all the telemedicine about.
Yeah. Well, thank you all. Thank you for bearing with me and my dodgy internet, which will probably go back to behaving as soon as I get off this. But I hope you enjoy the rest of the proceedings. And Leslie, Kim, my chair, thank you very much. Thanks for taking part in this, and I hope you enjoy the rest of your day.
Thank you very much.
Thank you.
Okay.
I'll be heading